Okay, so very good morning, everybody, and welcome to the doubt clearing session of the Healthcare Entrepreneurship course. I'm hoping that all of you are enjoying the course so far. Thanks for joining in from all across the country. I know there are close to 5,000 participants who have come in there from all around India, so this is lovely to finally interact with you all, right? So, today's session will be focusing on, I'll give you a quick summary of what the course intent is like, and what you have been seeing so far and what to expect, just to keep put the context right, like, and then I'll be happy to take in questions. I think there have been several queries and questions which we have been able to answer most of them, and I think there are few pending which I'll take today. But otherwise, happy to interact. There is a chat box session, so welcome to send in any questions. We'll be happy to interact and see where we're going. Also, do follow me on LinkedIn and other places. Like, you can always shoot me an email. It's a public information. If you have any queries or want to connect, outside the course, I'm fairly active on LinkedIn, right? So that connect is always possible. So, good morning and welcome everybody who are joining in. Sure, more and more people will be joining in. I cannot see the numbers. Shivam and Pramod are the TAs who are helping me out with the coordination. So, Shivam and Pramod, do you have a number on how many have joined in out of entire batch, or are we still expecting more? 500? Okay, only 5 people have. Okay, so more are about to join. So probably what we could do is uh, give it a few minutes before we start up with the summary, because the more the merrier. So we'll just speak with everybody. So in the meantime, I think good morning all who are coming in. I'll just quickly type a good morning to all who are coming in. Uh, okay, so I am interacting from Shivam's handle. So just good morning all from my side, right? So I'm hoping more and more can join in. So we'll just give it a few minutes. In the meantime, if you have any questions for the participants who have joined in, uh, it will be lovely to interact, and we'll just give it a few minutes for others to also join in, and then hopefully we can have a quick summary intro into what we had been doing and what is the overall intent. It's a very exciting course. I think we had been offering this for a while, so the goal is in line with the Make in India and Startup India initiatives, typically in the healthcare domain, and we're really trying to have us all built some healthcare entrepreneurial ventures for the future to come, right? So that's the goal, uh, and it's lovely to see so many participants from all around the country. Good morning, all. So I'll just give it a minute or two. Like, in the meantime, if you have any questions which are not answered from our side, by any chance we missed it, please let us know. The chat box. So the timing is 11 to 12. We'll be happy to interact the session. I do have a few questions which have come in once the announcement was out, but I'm not sure whether these questions are relating to the ones who have just joined it. So that's why I'll probably take them at a little later stage. That will make more sense once others have joined. Do we have more participants, Shivam and six? Yeah, the best part is we are on the same time zone, because I've been teaching courses where, participants are all around the world, right? So typically it's very difficult to match. Somebody is waking up, somebody. So it's very nice to see everybody so enthusiastic. Okay, so we are at around 11:07. So let me just start up with a very quick summary of the course and why this is so important. So healthcare entrepreneurship, if you see, is one of the very interesting and exciting areas of work, where it blends in everything in the healthcare industry. So from conceiving an idea where you are trying to build a product or build a solution for any issues which the society is currently facing, all the way to taking that through the steps of designing, prototyping, and assembly to take it finally out to the market is the goal of the course. So I often call it as you're looking at conception to commercialization of healthcare products and services. So that's the overall idea of the course, right? So we are expecting participations from a lot of undergraduate students who are from the engineering background, diverse engineering backgrounds, medical backgrounds. You could be somebody who is really enthusiastic to contribute to the healthcare space. You have some ideas, let's say, and you want to take it to the market. But the question here is how. So this is what the course teaches you. So the first few lectures are focused on conception, that how to conceive an idea, how to figure out that what do I want to work on, what healthcare products. So there are so many healthcare problems. If you look at the top problems around the country or globally, you're looking at cardiac issues, you're looking at diabetes, you're looking at flu, all kinds of viruses. There are n number of issues like in the clinic. There are lots of issues with neonatal care. You're looking at pediatric care, you're looking at dental care, optic care, like, so you name it, there are so many divisions of healthcare where there are issues and problems which you need to solve, right? So the step one is, wherever you're coming from, whether you're from the dental area or whether you're coming from with a pediatric background, or you want to create something for improvisation in a clinic or a product which is an app based, you need a start. You need to start with something which you're really passionate about, and these first few lectures are basically aimed at putting your passion out there and how to filter it through the right channel so that you are able to conceive that this is the idea we want to work on. And there are certain steps to look for, right? You need to understand the overall healthcare scenario in the country. So the first few lectures talks about what is happening globally, what is happening in India, what are the top problems, what is the infrastructure looking like, where all you have booming areas, right? Like for example, AI and machine learning is something all of us are very very excited about it. Where can you apply AI and machine? Which all things can you build physical products with? What is of huge interest to you? So getting that filter out so that you can pinpoint on an idea and go back to the board and say this is the idea I want to really work on, right? So that's the first set of lectures, typically in week 1. Week 2 is when you take the idea through some feasibility analysis to make sure that, okay, I have a great idea, but is it feasible given whatever resources I have around me, be it the funding, be it the amount of kind of team I have or the institution I'm associated with. Will I be able to accomplish something? For example, if I want to create a orthopedic implant and I'm a student and I don't have any resources, then it may not be the right idea to pursue as an entrepreneurial venture right there. But if I get associated with a medical device company or somebody who's working with the medical devices domain and I want to basically start an entrepreneurial venture, yeah, sure. I have a team along with it. I have some instrumentation with it. Yeah, I can go with it. So the set 2 lecture, which is week 2, typically takes you through the journey of where are my filters? What are my feasibility filters? What can I actually do? Because everybody can come up with 100 ideas, right? But what are feasible ideas? So this is where we focus on, right? So once we have pinpointed that this is a feasible idea, right? The next part is, how do I design it? How do I bring the idea on the table? Can I convert this idea into a drawing or to a frame or come up with a sketch? Because I need to have an outline and a plan in order to execute my idea. Then the following weeks goes from the design, and the concepts of design thinking and other things are incorporated. How do I take something from the design to a prototype, right? Prototype is a tangible version of a design. Design is something which is on a paper, typically on a piece of paper. Prototype is something which you can actually touch and feel. It's known as tangible, right? It could be an app wireframe. It's a prototype, right? Then along with these concepts, these are all technical concepts. You need to understand sales and marketing. You need to understand where are the customers. So one of the key component of entrepreneurial journey is, whatever great we think of, like whatever our ideas could be, probably we are coming through a lot of innovation, we are associated with good institutes, but our idea can be a complete failure if we do not have customers to sell it to, right? So in order to translate and have an idea actually reach out to the market, we need to have a customer base, right? So how do I find this customer base? Do I start looking in Delhi? Do I start looking in Chennai? Where do I go? So that is where I need to get into something which is known as customer discovery. I need to run surveys. I need to speak with a lot of people, go outside the room and really figure out that who can be my potential customers through a set of questionnaires, not just by knocking at a door and saying, will you be my customer? Many may say yes, but through a range of questionnaires which tells you that whether your customer is really interested or not. And if not, can they give you a feedback on how you can make this more interesting? So this is where we start talking about something which is known, a very important management concept, value proposition. That clearly states, whenever I am trying to become an entrepreneur, can I provide some value through whatever I have to offer to the customer, right? Whether I'm creating a product or an app or a solution, can I find some value for you? Because if there is no value to be transferred, then there is no need, right? I might be working, sitting at IIT Delhi in a very, very innovative product, but there may not be too many takers, right? So it doesn't matter where you come from. You may have great ideas. You may be from tier 1, tier 2, tier 3 cities, like, but you may be having the greatest ideas. But what is really important here is the execution strategy. So this course kind of takes you through the journey of how to execute things in the right fashion. There is a process and certain channels of, like, steps like which needs to be followed. It is never that I go on the board and the next day I go to the market. It never happens like that. There are set steps which needs to be followed, and you need to figure out that will these steps work in the right fashion, or I probably need to take a step back and reiterate and repurpose certain things and improvise and come back, right? So these things are very, very important. So customer discovery, that journey basically teaches you that, can I find a customer base, like can I interview 50 to 100 customers, get a statistically relevant data set where I've asked, let's say 20, 30 relevant questions around the value points, not typically technical questions which are trying to sell your product, right? Trying to gather value, that what would the customer really find value in around my product. Once I've figured this out, I should be in a better position to design and develop my product. So the goal of customer discovery here is, do not go out there in the market and waste a lot of your money. Before that, take a step back, hear it from the horse's mouth, which is basically your customers, and try to understand whether your customers really want what you're trying to build or they want something else. If they want something else which they're willing to buy, then you go ahead and build that, right? Alongside whatever you're trying to build. Like, not like you're trying to build A and all of a sudden you want to build B because the customer said it. It has to be something around A, but like, it has to be along with the feedbacks from the customers. So this basically gives you that platform that now my customers, at least 50 to 100 customers, have said this is what they want, and I have been able to build something which they want, which is known as MVP, minimum viable product. And you start with your wireframing and your prototyping journey starts. You need to understand sales strategies, right? What is branding? So these are some of the upcoming lectures which you will be seeing if you have not seen them yet. What is branding? What is the pricing model? So should I price my product too high? Should I price my product too low? Or should it be optimal for the market? What are the strategies, right? So this comes from a huge body of knowledge where I have personally been involved in running a startup company, and I've been mentors to several other startup companies, and these are some dedicated techniques through which you will have higher chances of succeeding. So after completing this course, I cannot tell you that 100% of you will be able to open your startup, but if you are planning to open your startup, you will have a much more higher chances of success. Earlier, if you had 30% of success, now your success chances would be around 90%, because now you have applied all the filters to get your things right. You've tried all the steps. It's like preparing for an exam. One part is I just read my book overnight and go show up for the exam. The second part is I go through all these steps, the years of preparation. Does it guarantee that I will do my exams greatly on the final day? No, not really. But it gives me higher chances, like around 90%, that most likely my exam is going to be better. So this is basically that preparation steps. You can think of something similar to the Shark Tank. I'm sure many of you watch Shark Tank. So when you go out there and actually pitch, where do you think those pitches come from? So there is a lot of customer discovery. There is a lot of market analysis. You need to understand what is your product's competition. So all these things you are going to learn from this course. So tomorrow, once you graduate out of this course, you will hopefully, if you're very interested and absorb everything, you'll be able to apply for Shark Tank or go for a venture capitalist, who is a funding agency, right? Like who are going to fund your products eventually, it funding agencies, which is kind of a similar setup to Shark Tank. They are going to ask for your pitch, that have you done your customer discovery? What's your pricing model? Why 500 rupees? Why not 200 rupees? Right? So everything is going to be questioned and you need to be preparing for the answers. So this course is going to help you with all those answers. There are lots of case studies, lots of examples, lots of personal examples which will help you connect certain fronts. I've tried to also use a few simple examples, like selling of a thermometer or selling of a glucometer, which are very simple devices, but how to stand out in those kind of markets. So entrepreneurial journey is where you are basically trying to improve your chances. Of course, we are a country booming with entrepreneurs. Uh, given there is a lot of push from the government of India, the rules, regulations of creating a startup has become easy. So those things are also kind of taught as a part of this course. How to find a IPR or file a patent or a copyright to protect your idea. Those things are also covered. Right. So all these things are going to be important, disciplinary components, like, discipline components, which will help you gather all your resources to be a successful entrepreneur. So that was the goal of the course when I started off. This is almost 4 or 5 years back. We started, an executive version of this course, and I also teach this course in IIT Delhi. We have a large cohort of students there, and there is also a book. You can look up my book known as Healthcare Entrepreneurship and Management. Same, just the term management is added. A comprehensive guideline for biomedical engineering. This is from Taylor and Francis, Routledge. You can look up this book. This has all the resources. There is a little bit of a lag. Is it okay? Like, is there a lag on the YouTube? I think there is something. We can continue. Okay. Yeah. All right. There seem to be a little bit of lag on YouTube. So please look up this book. This will give you a great resource. So whatever you're, looking at currently with this course, it's wonderful that you could join this course. This is the ultimate course of healthcare, where you don't only learn that how to conceive healthcare products, and don't only, like, figure out how to develop a product to certain extent and what all are the possibilities, but you also get to all those realms that how can I translate something to the market, right? Okay, so having said that, a big welcome to all of you for joining this course. I'm sure The exams and other things are mainly for screening, and that will usually be like something to test that you have been able to spend some time on the course. But I'm hoping that the overall goal here is to learn. It's not to basically focus on the exams or anything else. The overall purpose of this course was just to create an ecosystem where more and more people can learn how to apply entrepreneurship to healthcare. And whether you're a doctor, whether you're an engineer, you have any interest in the healthcare segment, remotely or directly, you should be able to create something up for yourself in the uh, direction of physical or digital product, and you should be able to translate it. So that's the goal of the course. Of course, it doesn't cover some of the topics very in depth, which you may think like product development and other things, because there are a lot of management concepts as well. But hopefully this will give you all the important resources to become a successful entrepreneur. So with that quick summary, I'm hoping that this gives you an outline. Let's take up some questions. I think finally I can see more folks who have joined in. So it's lovely to see you all. So let's quickly go through one of the courses in the chat box, and yeah, welcome everybody who are just joining in. So I can see Savan, he has asked a question which is on entrepreneurship opportunity in medical tourism and tier 2 and tier 3 city. This is a great question. Actually, we did some projects on medical tourism. Medical tourism is a very booming market. Uh, how to actually make it very effective? It's on the value points. So there have been various companies, and tier 2 and tier 3 is very lucrative because tier 1 is very expensive. Those, and you will not find a lot of opportunities there. For example, if you're looking at Delhi, and there are foreigners who are coming in, and you're trying to have them come to certain hospitals like the AIMS and Safdarjung. These are overcrowded hospitals, right? Like you are looking at Max Healthcare, some of the top hospitals which are extremely crowded because it's in a tier 1 city and we have too much going on here, right? But tier 2 and tier 3 cities provide us a great opportunity for medical institutions. There are lots of very good doctors and clinics which are which can treat patients end to end at a fraction of a cost what they will end up paying abroad. And I can speak this for myself because I've been in the US for almost 8.5 years, right? So it's quite expensive. Uh, Not only speaking of US, but majority of the countries abroad, if you're looking at dental and optics, it is not even covered under the insurance. To get a doctor's appointment is almost you're looking at a $400, whereas in India you're looking at prices like 500 rupees, 800 rupees, fraction of a cost. You can check yourself, like get yourselves diagnosed. Even the tests are much more at a lower cost, and the overall treatment is almost free of cost in some of the government hospitals. You'll be very surprised to see. I'm affiliated jointly with AIMS Delhi. So there are very sophisticated treatments which are completely done end to end, almost zero cost. All the tests, everything, high-end equipments, right? So entrepreneurship opportunities in medical tourism and tier 2 and tier 3 cities have to be built around clinics and nursing homes and hospitals where you can associate with. So you can serve as an entrepreneur in both ways. Either you could be a person who is actually conducting all this, like, so let's say you're a clinician who offers a certain kind of service and you are trying to offer medical tourism for that, or you could be a channel who has created an app or some kind of an aggregator kind of platform which is connecting a bunch of hospitals which are really good. Let's say you have 7 or 8 good hospitals in a particular area, and you have an app where you're trying to connect all these hospitals, and together you're trying to create an interface where somebody looks at that interface, they would see a overall package. It's like a tour package where they know these things are covered. Let's say it's a cardiac checkup package, or somebody who is trying to get a dental treatment done, or somebody who is trying to get a certain surgery done. And you come up with these packages through understanding the value points of the customers. So you have to understand a lot of inhibitions which the customers may have. For example, we did a survey for one of the project teams, and some of the customers felt that the hospitals they were tying up with were not extremely hygienic, not very clean. The doctors may not have the right degrees. So those all things you will have to make sure. So you have to get a feedback mechanism from the foreigners, like through surveys, and there could be not only foreigners, there could be NRIs. lots of NRIs are really interested in coming back and getting themselves treated because it's very expensive out there. And I've seen this for myself, right? Like it's very, very. So you can create custom packages for them because they'll understand the Indian scenario a little better. So these are two options. One is like foreigners, second is the NRIs, where you try to tap them, and you have to figure out their value points. What are the top things which they're looking for? And you have to connect them back with what can you offer, given you are in a certain tier 2 or tier 3. Hopefully this makes sense, and this can be all kind of wrapped up with an app or some website where you could be an entrepreneur who is basically running the show on basically the customer acquisition from one side and basically customer delivery from the other side, and you're basically taking a cut out of it, right? So that could be one of the possible models. Or you have some offerings alongside it, which basically it's like a like you have Make My Trip and Agoda for travel booking. So similar kind of packages for medical booking. So those kind of options can be explored, right? So hopefully this answers your question, Savan. If there are more questions, I'll be happy to answer those, right? Feel free to post your questions on the chat box. Very happy to interact. Okay, so how many people have joined Shivam and Pramod? Can you just clarify? Okay, yeah, some people have come in. Okay, so I'm going to quickly run through some of the questions which I think some. Okay, okay. So there are so the TS just informed me that there were some questions which were sent out by the students, like once there was this announcement of this doubt clearing session. So I'm going to read out some of these questions and try to answer those. Hopefully this will help also the others who are around to grasp some of the important concepts here. So the first question here is the healthcare entrepreneurship course, how will it help me earn profit in the future? So in order to earn profit, that's the major goal of an entrepreneur, of course, like you want to earn profits. So how can you earn profits? You can only earn profits by delivering something which is in form of a value to the customers who is actually willing to make a purchase, right? So just an interest is not good enough. Somebody just telling us that, hey, you know what, like your product is great, that's not good enough. Unless somebody really buys that product and pays me as an entrepreneur, I cannot be making profits, right? Like my entrepreneurial ventures will not fly. So how can the course help you in that? It will help you with all the knowledge that how to create the right ideas, how to get the value points, how to price things right, how to test the market. So all these things are very exhaustively placed within this course module, and it is all packed within this schedule of 12 weeks or so, where you get all this knowledge that how can you get all the filters right so that you are able to create a product which is actually translatable in the market, which with possible buyers, right? Because at the end of the day, if I just keep on building a product without any possible buyers, then it is of no use. I've wasted a lot of my money, right? So this is what the course is going to teach you, that please do not start creating your product all of a sudden. First of all, go through all the filters, try to really understand that how to really conceive a product, how to understand the feasibility of a product. Is the product even feasible given my resources? Of course I can talk today that I want to create a rocket and fly it somewhere, but is it feasible? No, right? But can I create something like of an app or some kind of a 3D printed product? Yes, feasible, right? Prototype which I can get it printed through a third party, some kind of a dental implant, some kind of an orthopedic implant. I create some designs, create some patents, license it to somebody. These kind of things can be done. So this course will teach you every way to how to create profit, right? And in order to that, to reach that point, you need all sorts of knowledge to get to that point, that what body of knowledge can really convert your ideas into profits. So that's, this course serves as this entire filter where you are coming up with 100 ideas. How does it filter it out to one very important idea where there is a value point, takes you through this journey of knowledge, and finally you are able to reach out to this point that now I know that these are the ways I can earn profit. So it tells you about funding avenues, it tells it about how to price things, how to brand your product, right? So everything. personal branding, so how to build a team. So everything is exhaustively covered as a part of this. And since I want to pursue an MBA, how will this be beneficial for me? So this was the question from the person. I don't know who asked this, but I'll be assuming X. If you want to pursue an MBA, fantastic. Because in MBA, what are you doing? Like you are basically going to become a master's in business administration, right? So you're going to learn businesses from an overview. So tomorrow you are going to be somewhere in of a manager who's going to manage a bunch of things. In order to become a manager, you need to be extremely knowledgeable. The profits are going to come from bottoms up, right? So every unit, the manager needs to look at profits. The people below the manager in a company needs to drive for profits. The salesperson needs to drive for profit, and that's how the profit will go up the ladder in the company, right? So MBA is a fantastic measure for like going ahead with this kind of course background. Now during your MBA, you will find very clear guidelines that, okay, so I wanted to do this and I found some value proposition. You will again revisit value proposition, how to sell things in the market, how to get to the market. This will reinforce your idea that in the healthcare segment, certain things may not work, but how to manage it more effectively and in a better way. So I think MBA with an engineering degree or a clinical degree or a medical degree where you are really keen on starting your company is a fantastic measure. Along with that, there is another layer which I want to add for all of you. Do also look for some experience. If you can maybe work with some startup companies or some larger companies where you can at least study and spend some time learning hands-on that how does companies function. I would urge you to more work towards a startup company because there the learning is exponential. In a larger company, you are usually given one role because the company is all set up. It has people with dedicated tasks. But in a startup, it might be that 4 or 5 or 7 people are working in that company and you are jumping from one role to another. So the learning is exponential. So you will kind of reinculcate some of the learnings which you get out of this course. So along with pursuing of an MBA, if you can get some hands-on into a startup, which is essentially a healthcare startup, that'll be a fantastic mix for you, and you will be in the right path to make profits. Right? So that's a quick answer for the first question here. Okay, so I'm going to flip back and take another question from Savan, right? And then take up the other questions, which is in the chat box. So in the medical diagnostics, a major part of money or margin is taken by the doctors, right? So how should we negotiate or offer our services when approaching doctors to refer patients? So this is a very good question. So let me link this up a little bit to your medical tourism and medical diagnostic business as a whole. So of course doctors will have their margins because they understand their value and what they're delivering and how much would that cost. So that's quite clear. You will have to offer something on the other side which has a margin of yours, right? And cut out a deal where the doctors can understand that, okay, so I'm probably bringing in 40% or 50% of your business from abroad or somewhere else, then I have some upper hand in actually negotiating certain margins, right? So you have to be valuable to the doctors as well. So there is a value transfer or value proposition transfer from one party to another. So let's assume you're the middle party who is basically working as an aggregator or some kind of a middle person who is basically connecting on one side to folks who are abroad who are trying to get to India to get themselves treated. So that's side A. You are B, and side C is the doctors who are looking for big margins. Let's say this particular doctor gets a huge cut out of whatever or huge has a huge margin across all the patients they usually treat. But once you supply or avail or translate a certain person from A to C, you have an upper hand in negotiating based on what you offer. So this side you will have to know what are their top value points and can you charge a premium on A side, and this side you will have to see how much is the doctor usually making and can you offer that doctor in a way that they are going to make a little extra, but not to that extent that all of a sudden they're using all the money which you are trying to get out of the A basically. So the A and C has to be balanced. So it's a mathematical equation you'll have to work out, right? So let's assume The person on A side gives you 1 lakh rupees to do a certain surgery, and that covers their travel, treatment, stay. Let's assume it's 1 lakh rupees. It's very small amount, but let's assume. So 1 lakh rupees, the doctor is usually supposed to be making, out of one such treatment, maybe 20,000 rupees, right? So you are the middleman. So what do you do now? Instead of 1 lakh, maybe you charge like around 1 lakh 30 or 1 lakh 40, where you have a buffer of 30 to 40,000. If they agree or come up with a negotiation, some discounted packages, let's say 1 lakh 20, you have 20,000 buffer here. And here you're looking at a doctor who is earning 20,000, tell them that you're going to earn 40,000. That way they are incentivized. So you are making a 20,000 extra here. What you have to pay to the doctor is 40,000. So how much are you making? 60 plus 20, right? You are making a 80,000 out of this situation. So by somebody paying 1 lakh 20,000, you are getting 60,000 out of it. Of course, there are more margins. It's not a direct calculation like that. Maybe ending up like, having like around 40 or 50,000, but you do make a cut. So you have to negotiate on both sides based on the value transfer. So that's a very quick answer to your question. That's how you basically negotiate. And we have had people negotiate that very well. Yeah. All right. Hopefully this answers your question. So I'll keep an eye on the chat box. If you have any other questions, feel free to ask. I'll be flipping back to the other set of questions which the participants have asked. So the next question is, through BSc biomedical science course, can I become healthcare entrepreneur, or I work as a medical instrumental designer? Please answer my question. Okay. So BSc biomedical science, it depends, even though we have biomedical engineering in IIT Delhi, we have a similar course across many institutions, similar for biomedical sciences. Of course, you can become an entrepreneur if you are coming from any biological background, right? It depends on your interest, whether you have some risk taking interest or risk taking ability, because see, whenever you're trying to become an entrepreneur, there are certain risks involved. It is not like, it's not a very rosy path where you just join a job, get an offer letter. You have to immerse yourself into a lot of learning, right? You have to get a lot of knowledge out of this overall learning, and then execute all this learning stepwise. You will have to gather funding. So you are kind of in charge of everything. You have to think out of ideas, you have to build the team, you have to gather funding, you have to figure out the customer discovery, who are my customers, how to negotiate with the regulators. So everything is about you as an entrepreneur, right? And that's how you end up becoming CEO of a company. So you yourself is a brand here. So do you have that kind of a intention or that kind of an interest? That is a bigger question than, like basically getting trained in any particular subject. So whether you're coming from BSc biomedical science or a BTech in biomedical engineering, it does not matter. Or whether you're from BTech in mechanical engineering, or you're an MBBS, your training doesn't matter. It has given you a certain platform where you have certain stages of learning. The rest of the learnings are your self learning, right? So you get to learn, like, so for example, if I work with medical robotics, I'm a mechanical engineer, by the way, like by training, but then I slowly moved into biomedical and learned electronics. So most of this part are self learning. I had to learn how to do robotics, I had to learn how to operate an Arduino, I had to do the MBA kind of learning by myself, right? What are the management concepts, how to do a pricing, how does the markets work, how to do a competitor analysis. So all of these things are self learning modules. This, nobody can give you a single resource and that you will be completely knowledgeable. So that was the purpose of this course. Can I give you a single resource here where you're able to get all these learnings, not deep tech learning, but like learning around the healthcare entrepreneurship realm, that how to create somebody who is coming from any background into a healthcare entrepreneur, right? With all possible learnings which we can pack within this 12 weeks. And then based on your interest, you self-learn certain areas. You want to create a robot, which is for conducting a surgery, go learn robotics, right? So that's what we all do. So my quick answer to your question is, whether you're coming from BSc biomedical science, fantastic, no issues. You have a biomedical background. Now align your interests, that can you do something about it? whether you're working with biomaterials or some kind of cellular lines, can you create something in the world of 3D bioprinting? There are so many opportunities out there. Can you do a medical device coating, for example? So your foundation or your primary degree will basically align your thoughts, because that's how you are typically trained to think. And based on that, if you self learn and focus on this course, you'll be learning how to become an entrepreneur in that. And of course, it's your interest which will drive you further, not a course, right? At the end of the day, I may go through 10-15 different courses and not have the intent or interest of taking a step ahead for entrepreneurial journey, because it's very risky. It may happen, so then you may not be an entrepreneur. But if you are having that intention that I really want to start something and it's a long term play, go ahead. With biomedical sciences, you will be perfectly aligned, right? Okay, so next question. Yeah, you're most welcome, Savan. Thanks for asking the questions. I'm hoping this is very useful question for all others as well, like to learn. So next is somebody asked, I want to pass an exam and get certification. Is there any previous year questions, materials, or any other source? So I don't have a very clear answer for you, because this course is getting offered for the first time. But I'm sure you will pass the exam, because we have basically created the questions and everything in a way that the course is designed for basically your learning, not to basically have a pass non-pass kind of a system. This is just to kind of reinforce that you spend some time going through the lectures. So if you have been through the lectures, you should be just fine. These are not difficult questions, right? And yeah, so can you get a material? Yeah, you can look for my book, Healthcare Entrepreneurship and Management. You can just look it up. It's on Amazon. You may get a paperback version for a little cheaper price, and if you're part of an institution, you may ask the institution for a copy of it. I've seen it is in most of the institution. Just look up Healthcare Entrepreneurship and Management. I will try to probably write it down. Healthcare Entrepreneurship. Just 1 second. I'll try to post the book here. Trying to just find the link of the book. So here you are. So this is the link of the book. I'm just posting it on the group. This is the link of the book. I'm not sure whether I can share anything else. Can I share a picture here? I can. So maybe you can take a quick picture. Maybe I would request Shivam if you can share it, take a quick picture. Okay, okay, okay. So, so they are able to see this, right? Okay, perfect. So this is the book, by the way, right? So I'm hoping you can see all this. So that's okay. No worries. So this is Healthcare Entrepreneurship and Management. This is the link for the book, right? Awesome. So this is everything packed in terms of the lecture modules which you're seeing currently. So we really thought that we needed a book for this, because many of the times you may miss out on some certain concepts, and also there are certain global concepts which are not only applicable to India but worldwide. So we have captured it in that way. So these are all part of that book. You can use this link. Amazon is one of the resources. It's from other places as well, right? All right. So coming back to the questions. Okay. So the next question is, so this question was answered. Please provide notes and PPT PDFs for studying where I can download and study it. So unfortunately, I don't have PPTs or PDFs for you, like as a part of the NPTEL module. That's what I understand. But you can always look up for this book where all this information is readily available, right? And there are all these lectures are getting recorded and they are on YouTube. I've seen yesterday, I think all the lectures are already on YouTube, so you can always rerun them, watch them. It will be much more nicer if you watch these lectures, because sometimes PPTs may not capture all the wealth of information which I end up sharing, because there are lots of stories, case studies which are typically shared. But having said that, I think there are some transcripts which the TAs are working on, and they have shared it with a few. So those things are getting modeled as we speak. Um, so I think medical tourism entrepreneurship opportunities, this question I have already answered. This was also asked in the chat box. PPT's notes, again the same question. So I would refer you to the book for this, because typically NPTEL modules, what I understand, there are no specific PPTs to share, and many of these have copyright issues. Okay, we use it for the executive programs and few other places. So we may not have a PPT to share directly for you, but please do look into the lectures, right? And like I just said, you can always look me up on LinkedIn, and you can send me a request. One second. So just to my LinkedIn profile, facing. Please feel free to connect on LinkedIn. This is my LinkedIn details. I'll be happy to connect and speak with you if you are around from Delhi, and if you want to come, meet and discuss anything in the area of biomedical engineering or entrepreneurship. I'm always happy and fairly available. And also likewise, whether you're coming from anywhere in the country, always happy to discuss. Of course, there are certain time constraints. May not be able to speak with everybody timely, but we'll be more than happy to, interact with many of you. So you can connect with me on LinkedIn, and usually I respond within a day or two. That's typically done. What else? Second, there are also some executive programs which IIT Delhi offers with the which is an executive version of the healthcare entrepreneurship and management program, which has a running project, by the way. So if some of you may be interested in enrolling for such executive programs, uh, which has a running project and a lot of hands-on, you're welcome to do that. But it's little bit on the pricey side, so it's more of something which is for the executives and the professionals. So we have the batch 4, which is about to start on the 21st 22nd of March. The enrollments are still open. So that is just a longer version of the NPTEL, and similar content, just the only difference is you get a lot of hands-on and lots of interaction sessions. NPTEL is for a wider outreach, and this is the way. It's very lovely to connect with a much more larger cohort and all around the country. It's great to see you all, and I'm really hoping the word of mouth will spread, and you will have more and more of your friends and colleagues who will be enrolling for rerun of this course next year, because this course will be rerun next year as well. And the goal here is not to only offer a course, but the overall learning. And some of you hopefully are able to start your company tomorrow. And the biggest, uh, biggest achievement for an educator like myself is when some of the students come back and say, hey, sir, like we have actually been able to start a company. We have been through your course. We have been a student, and uh, so whatever help you require at any point, we have had some great success stories. Dr. Omics Lab is an example, which came out of our executive program. Very successful companies, many other companies which have come up, so it's a wonderful entrepreneurial environment. Even in IIT Delhi, it's one of the major, institutions with unicorns. Unicorns are, of course, like big companies, like which have translated from the startup phase almost to the IPO phase and even more, right? So the opportunities are endless. Just try to gather the maximum amount of knowledge which you can get out of this course, and I'm really hoping some of you are extremely successful with this information. If you have any questions, anything more, feel free to interact. I'm always super enthusiastic and available for students, and happy to connect and even collaborate at certain levels, right? Like whatever is possible. So with that, I think we are almost heading to the end of the session. We have 6 to 8 minutes more. So I'll just wait for some more questions if there are any. Otherwise, I'll just give you a few words of motivation. So for all the students, I know there are close to 5,000 enrollments, which is a huge number for a first batch of an NPTEL, which is just lovely to see. You know that that clearly states that there is a huge interest in uh, healthcare entrepreneurship as a whole, and for starting up in the healthcare community. So which is an achievement in itself. Like, I'm really happy. So with that, I think it's really nice where some of you can basically look at some of the important modules here, like how to gather funding, how to basically create a pitch. So by the end of the course, what would be really lovely is if you can create a pitch, a slide deck of 10 to 15 slides, where you have all the components from all the way from how your product was initiated, into the customer deep dive, that what is the market looking like, what is the market analysis from Google search, what is the customer deep dive from customer search, what is the competition analysis, who are your competitors, what have you been able to create, and finally, is your product translatable, what is the rationale, what are the key steps have you followed to figure out that your product is going to get to the market. And these kind of things, once you encompass and showcase that there is a value and return on investment on something, there will be funders. These are typically known as VCs, venture capitalists. These are normal people like us, right? Typically, there are lots of people who have funds and money, so to speak, like who are willing to invest in companies, just similar to what you see in Shark Tank. They are willing to invest in companies which are high traction, and they have a huge potential of growth. So you may be in the seed round, you may not have too much funds, right? Then also many of them are really willing to invest if you are having a great idea and you have a clear execution plan. So great idea will not get you funding, great execution plans along with the idea will get you funding, right? So please keep these things in mind and try to gather all this information. And if you can have that pitch deck tomorrow, I think beyond this course, once you're ready to go for your entrepreneurial ventures, at least I will expect 10 to 20% of you all to be teaming up and going for that. Then please do use this pitch deck for reaching out to your VCs, and you can look up in Startup India. Startup India is a huge website where you will have access to a lot of VCs, like how to register a company, those all things are all there. Then you get a DPIIT registration, Startup India certificate, that gives you further access to VCs and people. So that will actually get your income and funding related concerns all sorted. So another quick question I think I'm going to take. So thanks, Savan, for asking several questions which are useful for everybody. So what entrepreneurial opportunities in healthcare can be pursued that are less dependent on doctors, such as preventive healthcare in tier 2 and tier 3 cities? So this is a great question. So one of the major segments in which India is focused on is diagnostics, right? So what are the top diseases in India right now? So every now and then you are hearing people dying of cardiac arrests, right? So cardiac issues are big because of lifestyle. It's a lifestyle based chronic issue, right? So cardiac issues. Second is diabetes. India is currently known as the diabetes capital of the world. So cardiac issues, diabetes, lots of other lifestyle based challenges like lung issues. Breathing is quite difficult in many areas, right? Because of the air quality, and there are lots of viruses which are going along, right? So what can you do here to really detect things? And cancers are at its rise. So 10-15 years back, you would remotely hear somebody in the distant family having cancers, but right now, if you look at any family, there would be some close one who is having cancer. So there's a huge shift in the lifestyle and habits which has basically had these kind of diseases emerge like anything. So what can you do sitting in a tier 2 and tier 3 cities? You can be developing applications. You can be developing applications, you can be developing diagnostic platforms, which basically allows them to, let's say there's a case of possible skin cancer. Can somebody take a picture out of a mobile with an app where this particular picture of a certain mole or some kind of growth is compared with hundreds and thousands of images using an AI machine learning model, and it tells that there is nothing to worry, or it tells it can be a possible tumor, please clinically correlate and go visit a doctor. This itself will create a huge confidence in the patients, because this is completely personalized. Another example is let's say you have some diabetic condition. Can you use a non-invasive glucometers, they are getting more and more popular in the market, and have some kind of model training, so that whenever there are certain algorithms which are observed, which are tied to your lifestyle habits or your food habits, there can be certain warnings or charts which tells you very clearly that these are the things to avoid. You have been having too much of sugar this week, or you have been having too much of carbs, too little exercise, please do this to keep yourself in track to avoid diabetes, right? So this is another example where in existing systems where you have sensors, you create a new app or a new module where it is giving better data to the customers, which is understandable and interpretable. I'll give you another example. One big issue is whenever you see a doctor and you have a disease which probably requires some surgery, typically happens with a lot of elderly these days. You may end up in this situation where you see reports where you don't understand anything. I think this is very common with most of us. You look at a doctor's report and you don't have an idea what has been written. What does this particular vesicle or these kind of anatomical terms even mean? So what you do next is you put the same into a chat GPT or do something and try to figure out, and you assume that the chat GPT will end up being your doctor, but that never is the real fact. So can you have a translator? Very simple solution. Can you have a translator which can read through and model train through a lot of doctors' prescriptions in a particular disease domain? Let's assume cancer or a radiological investigation, right? Which tells you that whether there is a cancer or not. This is a very simple question. Whether somebody has a cancer or not, there has been an investigation, there is a report, but after reading the report, the patient has no idea. They have to see the doctor before they can figure out. So can this report be placed within a app or a model where it can easily read it and tell you that it seems like there is nothing to worry, or there seems like there is something cancerous, you need to take attention immediately or take a second opinion. Another example is, can you create an app which gives you second opinion? Most of the youngster population, not even youngster, pediatric population, parents are extremely worried. Parents are extremely worried with whatever happens, and you're always looking for second opinion. Even with elderly population, it is very difficult to get a second opinion without any recommendation. Another example, can you create something which creates a pool of second opinion? Can you have some doctors like similar to Practo or somewhere else where they're just there to give second opinion? So these are just some examples to throw out there to get you thinking. There are of course hundreds and thousands of examples I can keep giving, but this is what you can do sitting at your home, and figure out. Of course you'll have to go out and understand and read the customers, but you can do a lot without having to liaison with doctors or go anywhere closer to a hospital. Hopefully this all makes sense, and I'm hoping this session was useful for all of you. Happy learning. I really wish you all the best to and urge you all like to get properly through all these lectures. I'm really hoping the modules were set in a way that all of you are going to learn a lot, and these learning is going to take you a long way, whether you're coming from anywhere in the medical community, whether you're in an existing company working on something and with some future aspirations of opening up a startup, or you have already started thinking towards building a startup. Wherever you are coming from, whether you're a doctor, engineer, or management professional, this is the time for you to create the startup of your own and make the most successful startup. And I'm really hoping this course is going to help you out. So lovely having all of you, and I'm hoping this was an informative session and useful for all of you. So please keep learning and connect with me, like if you need any further information, and do look at the resources which I've just shared on the chat box, like the book, and I've also shared my LinkedIn handle where you can connect with me, and I'll be happy to speak more. So lovely speaking with you all. I hope you all have a great rest of the day and the coming weeks learning. So thank you all, and signing off, right?